Hey guys, what's up? It is August 30th, and today marks 4 weeks since I had my surgery. So, for those of you who are just tuning in, I had a bilateral mastectomy on August 2nd after a diagnosis of invasive lobular carcinoma in my right breast, and I am 42 years old with no history of breast cancer, and I am negative for the gene, so it is kind of a mystery of how it appeared. But right now, I am just doing what I need to do to heal and get better. And I also had immediate reconstruction after my surgery, which means they put not implants, expanders under my pectoral muscles at the time of surgery, and for the past 3 weeks, I've been having them filled, and now I am at completion with that. Thank goodness, because yesterday was the last one and I could barely move, and I'm still having struggle with that. Even breathing is a little difficult, as you might be able to hear today. I'm having a little bit of a hard time catching my breath. Sorry, I know I'm not always making eye contact, but I'm busy looking at everybody's posting comments. So I like to look at the comments as you guys post. So hey, everybody that's here. So this is my 4 week update, and there's still things I'm waiting for. I'm still waiting to hear if I need chemo. As I announced on Friday, I do not need radiation, which was one hurdle down, one to go. Still waiting about chemo. Hopefully I will know by next Tuesday. I'm not sure, but I will certainly make an announcement as soon as I know about that. What else am I waiting for? Well, really nothing. Chemo is like kind of everything. If I need chemo, then it postpones my final surgery. If I don't need chemo, then it doesn't. So I will be able to book that surgery to replace these expanders with implants towards the end of October, early November, if I don't need chemo. So that is what we are hoping for, because these things are horrendous. I can't wait to get them out of my body. You can kind of see, I didn't wear black today, so you can see I look like I have boobs. So if anybody on the street saw me, they would not know I had a mastectomy. The difference is that they weigh 4,000 pounds. They're hard. They don't move. Because they're underneath my pec, yesterday when I had my last fill, it stretched it so much that I literally had, and I'm still having back spasms, because it's like pulling my pec and all the muscles around my back. So it's limiting my movement, and it's causing these ridiculous back spasms. And yesterday I was just laying on the couch all day, and even just laying there, I was like in 10 out of 10 in pain. It was a nightmare. But there's people that are going through way worse than I am. And with that, I would like to say that I feel even a little awkward doing these follow-up videos right now, because I just want to say my heart is really in Houston with everybody there. It's really tragic watching what's happening there right now. We went through Hurricane Sandy, and it was horrendous. It was probably one of the scariest experiences of my life. So I want to send love to anybody in Houston, and I will be figuring out some sort of way that I will be able to help somebody there, either through donations or some sort of something. I'm connecting with some people that I know that are in Houston, and I personally am going to find a way to help people. And I would tell everybody out there, if you have something to share or something to give, even if it's just a prayer for somebody in Houston, to give it, because I just remember after Hurricane Sandy how horrific everything was here, and it's something I'll never forget. And you know, it's a struggle. Everybody has a struggle. So as much as I was in pain yesterday, I realized that there are so many people out there that are going through different types of pain, and I just want to give a prayer and a positive thought to anybody who needs it right now in Houston and beyond. Okay, so I always, I don't want to just do these videos to do these videos. Like, it's not all about me, right? It's not all about like, how's Jen feeling? It's about a bigger picture, and it's about education, and it's about spreading the word about early detection, and letting people know out there, and educating people what it's like to have cancer, what it's like to be a family member of those with cancer, how you handle things and not handle things sometimes. Sorry, God, even laughing hurts today. So I made a list of like all the different things I can talk about in these videos to make them educational for everybody, because it's, like I said, it's not just about me. This is like way bigger than me. So one of the things that I wrote down was what to say and what not to say to somebody who's being diagnosed. And I know I've touched on it just a little bit, and I want to try to get you guys like in the mind of somebody who has cancer and what we're thinking about and what we're dealing with. And I want to tell you about that from both sides of the diagnosis. As a person who didn't really have a lot of cancer experience before this diagnosis, I have no family history. There was really, I've knock wood, I've never really lost anybody close to me from cancer. My feelings before this were like, oh, okay, you would get breast cancer. It's super curable if you catch it early, right? If you need a mastectomy, what's the big deal? You get new boobs. It's like a boob job. Maybe your boobs will even look better. It's not like anybody will know that that's what's happening to you or know what it looks like underneath your clothing, right? So you get new boobs, you put on a bathing suit, whatever. It's fine. It's all good. You having a mastectomy is the cure, right? And if you do that, then you're never going to get cancer again. And you don't have anything to worry about. And these are all the things that I thought prior because I didn't have an education as to, what breast cancer was really like. In a way, I feel bad about that because I wonder if I supported people in my life that had it the way I should. And in a way, I miss that naive time in my life, that innocence where I didn't know any better. Because man, have I gotten an education over the last month. But there's a lot of people that say things to me that I can look at and say, they're just trying to help and they're just trying to love any way they know how, and they don't know what I know and what other breast cancer affected people know. So I'm going to tell you a little bit about that. And I'm going to mention some things. And if any of you watching or whatever have said this to me or to anybody else, please know I'm not angry. I'm not upset. I don't hold grudges. But I see it happening a lot. And so I want to make it, I guess I want to make it a little bit clear so that we all sort of understand how breast cancer touches your life. It's not just cutting off your boobs and moving on with life. It's so much deeper than that, and it's so much more difficult than that. I thought even when I was diagnosed that having a mastectomy was a cure. If I cut off my breasts, I will not have the cancer anymore, and it will not be anywhere else in my body. I will be clear, and I'll be fine, and we're getting rid of everything that breast cancer can affect. But that's not the truth, number one. So anybody out there that thinks, okay, well, you're having a mastectomy now, you have nothing to worry about, it's not true. Does it lower the risk of us getting breast cancer again? 100%. But it's not a cure. It's not an answer. Thank you, Jana. She saw the tears coming. It's not a cure. And what sucks about it is that you go through like such a difficult surgery. I mean, the surgery, it's hard, you guys. Like I come on here and you guys are amazing and you're telling me how great I look, and I do. I feel good. And I haven't worn makeup in 2 months, but I at least try to do my hair and try to put on a normal shirt and try to feel good every day. But the truth is that I have these like baseballs on my chest, and I don't feel good. I feel like crap. I'm exhausted. I have no stamina. I miss my work life. I miss my real life. And, I don't know. I think people think like, oh, cutting your breast off is brave. It's not brave. I had no other option. So I don't know how brave it was. I had no other option. But, when people say to you like, your boobs are gonna, you'll have, oh, don't worry about it. It's not the people that say, I'm sure you're gonna look great after this. It's the people that go, oh, don't worry, your boobs are gonna look amazing after. Maybe they will, maybe they won't. I'm not really sure what they're gonna look like after because right now they're a hot mess. But it's not about that necessarily, and it's not a boob job. Like I just want to make that really clear. Like go, and there's nothing against boob jobs, but like there's to go in to have breast implants put in, it's like an hour-and-a-half procedure. They open you, they put in the breast implants, they make sure you look good, they close you up, and then you're sent home to recover. This is a much different experience. These expanders and the healing of the wounds and the pulling of the lymph nodes and the drain sites and the fact that for 2 months I have to walk around with what are essentially lopsided boobs because they're not exactly perfect right now, although they promise me they'll fix it during surgery, that are uncomfortable and hard and they weigh on my ribs is the furthest thing from a boob job. And how I wish that I could just have breasts that look way better after, but even if they do look way better to everybody else, they're never going to be my breasts. Okay, when you get breast implants, they're still your breasts that are amplified. My breasts will never be my breasts. And will I own them and will I love them? Yes, but are they going to be part of my body? Never. They're never part of my body. They're always something artificial. It's like walking around, like let's face it, it's an amputation. Okay, I had a body part amputated. So if you had an arm amputated, you would go around with a prosthetic, and nobody would ever say to you, "Well, your arm will look better than it ever looked before." Because they realize there's challenges in that prosthetic. You need to learn how to use it. You need to be able to put clothes on it, or whatever it might be, wherever you have a prosthetic on your body. This is really the same thing, and I know it doesn't seem that way because it doesn't serve a function, right? It's not opening jars like a hand might, or it's not running like a foot might. But there is power in breasts in a way, and even though it's not performing a function day to day, it's just, I don't know. What you guys see underneath my clothing, my boobs might look great, but what I see when I look in the mirror is a very different story, and I will always have these scars. And I'm okay with that because I know that like anytime I need it, I could just look down and go, okay, I'm badass. I can do anything. But I guess my point is I want you to think when you say to somebody, oh, well, I bet your boobs will look better after this. There's a chance they might. In fact, on many of us, right? Because we're old and we had kids and our boobs are down to here. Yeah, my boobs probably will look better to you after I have my surgery. But to me, they're never going to be mine. And, it's not an insensitive thing. I realize when people say it that they're trying to make me smile and make me look at the positive. And I think that I am a pretty positive person. But it's one of those things that when people say it, I go, oh, they don't get it. And you know what? It's okay that you don't get it because you don't have that experience with it. And I feel blessed for you that you don't, and I'm so happy that you don't. But I just want you to think when you say something like that it's not as simple as it sounds. It's weird. Like yesterday, I was at Sloan and I was sitting in the waiting room, and there were all these women in there waiting for the plastic surgeon, and some were pre-surgery and some were post-surgery. And I couldn't tell, I couldn't tell which was which, besides the few women that had their mastectomy bras sticking out, and I knew that they had gone through some sort of surgery. I couldn't tell who was real, who was artificial, who had expanders, who had, as I call the TFBs or the PFBs, the temporary fake boobs or the permanent fake boobs. And you walk on the street and you just don't know, what people are going through in their lives. And just because I look like I have boobs doesn't mean I'm not struggling with that. But if I just walk into the grocery store, nobody would know that I'm having a problem. So what you see on the outside is not always what matches on the inside. And I just think that that's a lesson in life also. And I just want to kind of mention that we see people on the outside with hair and makeup done and they look beautiful and they take care of themselves, but what's happening on the inside, just even under a small layer of cotton, might be a totally different story. So just to have love and compassion for people in that way. One of the other things I get a lot of right now is suggestions on what to eat or supplements to take, or videos about how bad chemo is for you, or suggestions for alternative medicine, and things of that nature. And this is really where I struggle because I really understand that people are trying to help me here. I really do get that. And people feel helpless. So they feel like, okay, to help you, I'm going to make a suggestion. You should buy this supplement, or you should eat more blueberries, or kale will help you. And here's the deal, guys. I have always been a healthy eater, and I have always taken care of myself, and it doesn't matter. Okay, some people are just let's start that again. Some people just have a predisposition for cancer, and something just sets it off. And I guarantee it's not kale, or it's not enough blueberries. And I get it. Like, believe me, I bought a book. I have it right over here, like Whole Food Diets for Breast Cancer Survivors. And I'm totally into the nutrition, and I'm working with my doctors on supplements and things of that nature. It turns out I'm extremely vitamin D deficient. So women out there, get your vitamin D checked. It is one of the things that does lead to actually, well, I shouldn't say that. There is some suggestion that a vitamin D deficiency can lead to a higher risk of breast cancer. That's how I want to say it. And I do have a deficiency of vitamin D. so there, I'm under strict doctor's orders with certain supplements and dietary things, and um, the hardest is when somebody's trying to sell you something like, well, I sell supplements that will help you, so you should take a look at all my videos. And again, I know they're trying to help, but like right now in the thick of it, maybe isn't the time to mention it. Or maybe to ask, are you open to something like this? Or, can I help you? Is there a way that I can help you? I have knowledge in this area, something like that. There are some people that have approached me that are just jerks about it, and some people have approached me who are very kind about it. And just to be sensitive to that, I think is really important, because we have so much that we're processing emotionally that it's confusing. So what happens is when people like you have a lot in your head, and then all of a sudden you go, well, wait, am I doing the right thing? Should I be doing this treatment? Should I be eating this? Should I be? And it becomes extremely overwhelming. You go to brush your teeth, you're like, is it the toothpaste that's causing my cancer? Is it the nail polish? Should I not wear nail polish? Should I not be putting this in my hair? Should I change my deodorant? Where is this from? Is it non-GMO? Is it, like you could get crazy. I'm just telling you, as a cancer patient, that everything around you is toxic, and you could really get into your head about it. And it's one of the things that I need to be really careful about. And I think most cancer patients are like that. So just to be cautious of that overwhelming thought. I mean, I think that if you have something to offer somebody that has cancer, to ask them would be a very nice thing to do, if they're open to hearing things, or if they need something and what do they need in the moment. But when you're in the thick of it, like I am right now, I don't want to hear about it. In fact, I know sugar, like cancer lives on sugar, but if you have chocolate to bring to my house, please do it, because that's where I'm at right now in my headspace. It's just where I'm at right now. And to just ask people. The third thing I would like to say to people out there, and again, I know people are trying to help, and they're trying to have sympathy, and they're looking for a camaraderie. But people will say things like, I'm sorry to hear you have breast cancer. My mom died from breast cancer, period. Or my cousin struggled with breast cancer for 10 years. It was awful to watch. Here's the thing. I feel really bad for you. Like, you don't understand the sympathy that I have for that, but it scares the shit out of me. So I want to hug everybody out there that's been affected by cancer, and especially those who have lost loved ones, but please stop scaring me, because I'm trying to be the other person who lives through this journey, and I want to help you, and I want to be connected with you emotionally. But maybe following up, like, my mom died of breast cancer, but she was really strong, and I know you are too, would be great. Just a little follow-up, like, not just to be like, my mom died, period. It just seems very final. And it's not that it's not cool, and it's not that it's not sweet of everybody to share, but I'm just trying to explain to you that when a cancer patient is in the thick of not only trying to survive this disease, but figuring out how to have a normal life again, because listen, I don't need radiation, and if I don't need chemo, like, I could have my second surgery and then essentially go back to my life, right? But what does that even mean? Like, what does going back to your life even mean? Because everything is different now. Where I want to put my time and my energy and what's important to me is completely different now than it was 2 months ago. And I just want you guys to see that from a cancer patient's point of view. Okay, you are still talking to me like I am the person I was 2 months ago, but I'm not that person anymore. And it's not to say that I don't realize that you're all being kind to me or to somebody else or whatever, but there's certain ways of approaching people. And I've had a lot of that too. I don't want to make it sound like everything's been a negative experience. That's not the case. And in educating you, I'm trying to help you help somebody else, not put anybody down that has experienced any of this or said any of this. I hope that that makes sense, because I certainly don't want to come off as being a bitch here. Yeah. Also there's that whole theory of like, well, just think positive and everything will be okay. And you guys know that I'm positive 100%, but every once in a while it's so nice. And you guys have all done this for me, when somebody is just like, this sucks. I'm just in it with you. This sucks. I hate this. This is awful. Because it is awful. And here's the other thing. I don't know if I will ever not live in fear, not live in fear again of cancer coming back. And even though I don't need radiation, and if I don't need chemo, it will look like, it almost feels like cheating. Like I don't need treatment. Like that's like cheating. But the truth is that I will be taking medication for at least 10 years to try to prevent cancer from coming back. When you have a mastectomy and they take out all the breast tissue, all they need to do is leave one little cell behind, one little tiny cell behind, and you can get cancer again. There's no guarantee that they're getting everything. And it's scary as hell. And that's where my head is right now, like fighting that demon. So I know you all want to help me and you want to help others by sort of saying, oh, it's no big deal. It's going to be fine. It's great. Eat more kale. Don't be like my mom, whatever it is. But sometimes we need something different than that. And I don't want to tell you what we all need because I'm only one cancer patient. I'm only one person. I'm only one cancer patient. And I have a positive attitude 90 to 95% of the time. I don't think everybody's like that. So there's a lot of people out there, probably in all of your lives right now, that need support in some way. And they might not even know how, but I guess just my suggestion to you is just ask them how you can support them. And maybe that just means sitting with them and crying, or maybe that means like, I don't know, just facing the reality about what they're going to look like and what they're going to feel like. Because even if I never get cancer again in my whole life, knock wood, I carry it here, the reminder every single day, and every single time I look in the mirror, and every single time I shower, and every single time I get changed, it's here. And it's okay. But some days it just sucks, and I'm angry about it, and I'm sure you guys all know somebody that's going through the same thing right now. So that's my point. I'm kind of rambling, but that's my point. To just love people and just be with them when they're struggling. And sometimes fixing somebody's problems doesn't mean fixing their problems at all or doing anything. It just means sitting with them and being there for them. And honestly, laughter is the best medicine in the entire world. So if you can make somebody laugh today, if, instead of saying to somebody, eat more kale, maybe you could say, hey, I have a joke to tell you. It's really funny, or a funny story, or you send them a funny book, or you sit and watch Dumb and Dumber with them and just make them laugh, because the best medicine in the entire world is some sort of normalcy and laughter. And I was not planning on getting emotional today, damn it. But I love you guys, and that's my 4-week update. And some what not to say is to people that have cancer, or maybe just say it in a different way, if that makes any sense. But I love all of you, and I love all of you, even if you told me my boobs will look better than this in the end, because they probably will, I know that. But I don't know. I love you, and I'm glad that you guys tune in. And again, please feel free to share any of these videos that you think will help anybody out there, whether it's the cancer patient or if it's families or friends of cancer patients that need to know how to deal with cancer patients and what to say to them and how to do, because this is all about education. And ladies out there, please make sure you're touching your boobs and you're checking for lumps and you're taking care of yourself and you're being your own advocate. So many of you have written to me about, like, what do I do about this? What do I do about that? I'm not an expert, but I'm happy to help anybody any way that I can. And let's just take care of ourselves, because, the world needs us. So have a good day, you guys. I will post another update. I guess I've been doing them about once a week. Do you guys like them about once a week? If so, I will keep up with that. Love you all. Hope to see you soon, and good health.